This podcast is supported by Zoll LifeVest. Sudden cardiac death is a leading cause of mortality in low EF patients with heart failure or following a heart attack. Zoll is proud to partner with your care team to pursue better outcomes together. Visit lifevestresults.com to learn more.
Worldwide, cardiovascular disease affects the lives of hundreds of millions. Dedicated CardioNerds everywhere are working hard to fight this global epidemic. These are their stories.
My dear CardioNerds, this is Ahmed Ghoneem. Join us on a new adventure as we journey through the maze of clinical practice guidelines. In this series, Decipher the Guidelines, we will take a deep dive into the 2021 ESC Cardiovascular Prevention Guidelines, focusing on similarities and differences from the American guidelines. This is a multidisciplinary collaboration between the CardioNerds, the ACC Prevention of Cardiovascular Disease section, the National Lipid Association, and the Preventive Cardiovascular Nurse Association, developed with the mentorship from Dr. Eugene Yang.
And remember, CardioNerds is a fellow-founded, independent educational platform. The views expressed here do not necessarily reflect the opinions or policies of our employers. Do be a nerd and spread the word on social media and help others find us by rating and reviewing the show on your favorite podcast platform. And with that, it's time to get nerdy.
The following question refers to Section 4.4 of the 2021 ESC Cardiovascular Prevention Guidelines. The question is asked by Dr. Maryam Barkhordarian, answered first by medicine resident Dr. Ahmed Ghoneem, and then by expert faculty Dr. Noreen Nazir. Dr. Nazir is Assistant Professor of Clinical Medicine at the University of Illinois at Chicago, where she is the Director of Cardiac MRI and the Preventive Cardiology Program.
Thank you, Anushka. Ms. J is a 57-year-old woman with a past medical history of myocardial infarction, resulting in ischemic cardiomyopathy, heart failure with reduced ejection fraction, and major depressive disorder, who presents today for follow-up. She reports feeling extremely overwhelmed lately due to multiple life stressors. She is on appropriate cardiovascular GDMT agents and is not prescribed any medications for her mood disorder. So, Ahmed, what do you think? Is this true or false? In addition to psychotherapy for stress management, it is appropriate to consider Ms. J for antidepressant SSRI pharmacotherapy at this time to improve cardiovascular outcomes.
Yeah, thanks, Maryam, for that question. The correct answer is actually false. An ESC Class 3 recommendation states that SSRIs, SNRIs, and tricyclic antidepressants are not recommended in patients with heart failure and major depression. This is based on data suggesting potential lack of SSRI efficacy for reducing depression or cardiovascular events, as well as safety data indicating an association between SSRI use and increased risk of cardiovascular events and all-cause mortality and cardiovascular mortality amongst heart failure patients. Mental health disorders are associated with worse outcomes in patients with ASCVD, and appropriate treatment effectively reduces stress symptoms and improves quality of life. Non-pharmacologic modalities of treatment, such as exercise therapy, psychotherapy, and collaborative care, should be considered before pharmacotherapy to improve cardiovascular outcomes in patients with heart failure. Of note, the ESC suggests SSRI treatment to be considered for patients with coronary artery disease without heart failure and moderate to severe major depression based on data that SSRI treatment is associated with lower rates of coronary artery disease readmission with a relative risk of 0.63, all-cause mortality with a relative risk of 0.56, and the composite endpoint of all-cause mortality MI-PCI with a hazard ratio of 0.69 versus no treatment. This is a Class 2A recommendation. ESC also gives a Class 2A recommendation to consider referral to psychotherapeutic stress management for individuals with stress and ASCVD to improve cardiovascular outcomes and reduce stress symptoms. The ACC AHA guidelines do not provide focused recommendations regarding mental health considerations in patients with elevated cardiovascular risk. So my main takeaway is that it's important to consider mental health treatment in patients with ASCVD, as mental disorders are associated with increased CVD risk and poor patient prognosis. And data supports that mental health interventions can improve overall and CVD outcomes, as well as improve quality of life. Dr. Nazir, what do you have to add on the nuances of the management of depression and anxiety in patients with ASCVD and heart failure?
This question actually touches base on two things. One is question-taking skills, which maybe I'll address at the end of what we're going to talk about from an educational standpoint. But from an education standpoint, you can review our ACC/AHA guidelines and you will note that there is one component in here. Adults should routinely be assessed for psychosocial stressors and provided with appropriate counseling. And then you move on to the next types of topics. In the ESC guidelines, they really have quite a bit of information regarding mental health care and psychosocial intervention. So as we do know, a lot of patients come to see the cardiologist. A lot of patients actually have a almost primary care relationship with their cardiologist. And evaluating patients for psychosocial stressors is a very large component of the care that we provide patients, just in general for them to be engaged in their own health care, but also because we may be the only physician, only clinical care provider patients see, we really need to be engaged in this. So I think the ESC guidelines, they go through and make an effort on how to do this and why you need to do it. And then the second part of the question taking, when you're reading the question, you just make that assumption, well, heart disease, we should be doing it because it's heart disease. We should be recommending all the therapies for the antidepressant therapies for the patients. But actually, when you go look closer, it's specifically in the guidelines stating that it's appropriately recommended for patients who have coronary heart disease. But in patients with heart failure and major depression, SSRIs, SNRIs, and tricyclic antidepressants are not recommended in class 3 recommendation. So really, when you're looking at a question, make sure that you don't get caught off guard by saying myocardial infarction, ischemic cardiomyopathy, that's coronary heart disease. But you read through, heart failure with reduced ejection fraction. That's probably not going to allow the patient to, that's actually going to cause the patient to need a class 3 recommendation for therapy.
Wonderful. Thank you, Dr. Nazir, and thank you, Ahmed, for this great discussion.